On this episode, we'll talk about something very common after gastric sleeve surgery, and that is a bubbling noise or sensation your stomach makes.
3, 2, 1.
Here we go!
Hi, I'm Dr. Álvarez with Endobariatric.com, and today we will be talking about something patients discuss quite frequently, and that is a noise your stomach makes, and that is a bubbling noise or sensation that you might perceive, you might get. This is something that will not put your sleeve at risk. This is something that I like to tell patients that you might get the first few weeks right after your surgery, or you may get it years after your surgery, but the cause is the same. The cause of this is swollen tissue, and that is why you might get it right after your surgery, and where your swollen tissue, the stomach is very swollen, very tight. There pretty much isn't enough space in there. You're doing liquids, and we've talked about the gurgling sensation or the gurgling noise or the noisy sleeve before, and it's pretty much the same thing, because when you pour liquids in a funnel, you imagine yourself, you have a funnel and you pour liquids right away, you'll hear that gurgling noise and it'll try to go down. That is because your sleeve is so diminished in diameter because of the swollen tissue that you'll get that gurgling noise. We've made a video on that talking about the gurgling noise. Today we're talking about the bubbling noise, because it is when you get the gurgling, that's when liquids are going down. But when you get the bubbling noise, it's when gas or air is trying to go upwards. Before your sleeve, you had a big stomach. We all are able to hold gas or air that we swallow while we're talking or while we're drinking or eating. It's normal. We are going to be swallowing some air. This air goes to the fundus of the stomach that has the capacity to adapt to that gas, except when we're babies. And that's why babies get a little uncomfortable. They cry after they're eating because they're sucking air. And that air, the baby does not have yet the capacity to manage that air or that gas. When you get a sleeve, that fundus, that part of the stomach is gone. We eliminate it intentionally because that part of the stomach also produces ghrelin, the hunger hormone, and we as bariatric surgeons, we are after that part of the stomach. We want to eliminate that part intentionally. So that gas has nowhere to hold or to be held by the patient because that fundus is gone. So that gas from the bottom of the sleeve, the bottom of the stomach, tries to go up, or it actually goes up, but the patient may hear that bubbling sensation I'm talking about. And that is why I tell you, or I tell the patients, that you will get it initially, the first few weeks after your surgery, because your sleeve is just recently crafted, you just had your surgery, and that swollen tissue is present. So what do you have to do? Take your acid blocker, take your PPI, as prescribed by your doctor. That will bring the swollen tissue down quicker, sooner, and will make all these symptoms go away quicker. Is there something wrong with your sleeve? No, not at all. So I'm here to tell you, put your mind at ease. Nothing's wrong. It will go away. Now let's talk about years after. What happens if you get this bubbling, or you hear the bubbling sensation or that bubbling noise years down the road? Well, what happens is your sleeve got swollen again. Not because you just had surgery. You're talking about years after. It's because something caused that sleeve to get swollen. But how? What? What did you do to cause this swollen tissue? Well, let me tell you, it could be caused by pretty much anything. It could be caused by stress, can cause gastritis. It could be caused by excess of alcohol consumption, coffee, smoking, spicy food, it could be caused by many, many things. So I tell patients, sooner or later, you will get that bubbling noise because it flares up because you got some gastritis, some inflammation of the inner layer of your stomach. What do you have to do? Exactly the same thing is take antacids, take your PPIs like omeprazole, take it twice a day, but you need to take it at least for some 30 days for that swollen tissue of your sleeve to come down. And guess what? That bubbling noise or the gurgles will go away. All right. Again, nothing is wrong with your sleeve. You might get it eventually. You might get it, let's say 6 months out, a year out, 2 years out. And you might get it again afterwards. So take another round, touch base with your bariatric surgeon if you have any questions. And, well, my patients always have my direct email. But I'm here to tell you that nothing is wrong. You might have this sensation, hear that noise the first few weeks right after surgery or even years down. But the cause is the same thing. It's inflammation in your sleeve that we can take medication to make it go away quicker and make those noises go away as well. So I hope you found this useful. Hey, don't forget to subscribe if you're into gastric sleeve weight loss content. And if you like this episode, if you can leave me one of these, it's very useful to our channel for the YouTube algorithm. I'm Dr. Alvarez with Endobariatric.com, where we are changing lives. Guess what? One sleeve at a time. Take care and God bless.